Hey, my amazing people! We are going to discuss a very important topic in relation to your Aims, PGI, and Neet PG, that is inverted papilloma. Now, why it is very important to know this topic of inverted papilloma? Because it is the second most common benign tumor of sinonasal tract. So, second most common after osteoma. So, it is very important that you know what is it, because they are going to ask something from this inverted papilloma. Also, it is the most common surgical indication for surgery in case of benign sinonasal tumor. So you now know how important it is to know about inverted papilloma, also called as transitional cell papilloma, ringus tumor, and Needarian's papilloma. So it has so many names. So that's why it is very important, and one of the common thing we find in our day-to-day surgical practice. So very important. It is basically a tumor of non-olfactory mucosa of the nose, also called as Needarian membrane. Okay, so non-olfactory mucosa of the nose, a benign tumor which has the most common site of origin in the lateral wall of the nose in the middle meatus. Okay, so in the middle meatus, lateral wall of the nose is the most common site. Now, why it is called as this inverted papilloma? Why this inverted name? You know why? Because the hyperplastic papillomatous tissue grows into the stroma. It grows inside the stroma rather than in the exophytic manner. Okay, so this if you see the histology picture, you will see that the the papillomatous tissue is going into the stroma. So I'll post that in my community section. You can see the histology picture where you will see the hyperplastic papillomatous tissue going inside the stroma rather than in the exophytic manner. That's why it is also called inverted papilloma. Okay, so human papilloma virus is thought to be responsible as one of the causative factor of this inverted papilloma, and clinically men are affected more than women, and typically the age group is around between the 40 to 70 years. Okay, so mostly it is always unilateral, presents with nasal obstruction, discharge, and epistaxis, and it can also invade sinus and the orbit. So what you all will find on examination on diagnostic nasal endoscopy, it will present as a pale polypoidal mass, resemble simple nasal polypus or polypi. Okay, on CT scan and MRI, you can see the location and extent of the lesion. The MRI will also help you to differentiate it from the secretion in the sinus and from the actual tumor mass. But for the diagnosis, we typically need a biopsy. A biopsy is must for diagnosing a inverted papilloma. Seeing the histological picture where the hyperplastic papillomatous tissue will be going inside the stroma will fetch you a diagnosis of inverted papilloma. Okay, so why it is so important, you already know. The symptoms you already know, and the association you already know. HPV associated, and in some time the association of inverted papilloma is with squamous cell carcinoma, and it can turn into malignance also. So 10 to 15% of cases of this inverted papilloma are associated with malignancy. That is why their surgical treatment is very important. And what is the treatment of choice? Treatment of choice is medial maxillectomy operation. Nowadays it can be performed by lateral rhinotomy or sublabial degloving approach. So these are methods by which you will do the removal of the tumor. Medial maxillectomy is the treatment of choice, I repeat it, and nowadays we are doing it with endoscopic methods also. Okay, so endoscopic removal of it is being done nowadays, but there are some contraindication to this endoscopic surgery for this inverted papilloma when we will not do it. So this can be one of your future Aims question, although it is a postgraduate level, but they can ask you. So what are the endoscopic contraindication of this removal of inverted papilloma? If The inverted papilloma of the patient involve the mucosa of the frontal sinus. Okay, if it has transorbital extension, that is involving the orbits. If it is present with a malignancy, concomitant presence of a malignancy that involves critical areas, if there is presence of significant scarring and anatomic distortion from previous surgery. Okay, so these were some of the contraindication of the endoscopic approach to remove the inverted papilloma. And what will be our aim? Our aim will be to dissect the involved mucosa along with the subperiosteal plane and to drill the underlying bone whenever required, and by seeing the intraoperative finding. Okay, so extent of the operation will be according to the site of lesion and the area of mucosa involved by the lesion. So there are basically three types of endoscopic resection, less important for you all, so I'll discuss this in last. And basically we follow up it with the regular diagnostic nasal endoscopy, and post-operatively we do MRI and CT only when the patient is symptomatic or we see a residual or recurrent lesion by biopsy. And radiotherapy is not at all advised as it may induce malignancy in case of inverted papilloma. So I'll summarize it for you that inverted papilloma, also known as transitional cell papilloma, ringus tumors, Cnidarian papilloma, has the most common origin at lateral wall of the nose in the middle meatus. Okay, it is a tumor of a benign sinonasal tumor arising from non-olfactory mucosa of the nose, and HPV is associated. Men are affected more than women. In the age group of 40 to 70, orbit involvement may cause proptosis, diplopia, lacrimation, but mostly and usually these are unilateral, present with nasal obstruction, discharge in epistaxis. CT and MRI are helpful, although in diagnostic nasal endoscopy we see it as pale polypoidal mass resembling a simple nasal polyp, and the treatment of choice is medial maxillectomy. Okay, so this all for you to know about inverted papilloma and one of the important topic, and you can take my words that you will find it in one of your exam in future. So do revise it and note the important points. This is Dr. Shivam signing off. Thank you. Stay happy, stay confident and study hard.